Stroke is not a death sentence, and it's not a spiritual problem. I'm not disputing the fact that people use voodoo on themselves, but stroke is not a death sentence. Okay, now stroke does not just attack someone unannounced. It will have given you at least 2 months notice. Stroke will have given you warnings that it's coming, at least 2 months. And then when it's coming, most time people see it as malaria. The symptoms will be malaria. So you feel this heaviness, you have fever, your temperature goes up, and then you begin to have maybe heaviness of one arm and one leg. You begin to have your joint begin to ache you most of the time. Then you begin to have this blurry vision. These are early signs that stroke is coming in. But most time we feel that it is malaria, or we feel like it is malaria, so we don't take it seriously. Now, but imagine you constantly monitor your health issues. You check your BP, or you check your sugar level. You should know that this thing is coming, so you should be able to know how to prevent this thing. You don't have to wait until stroke actually comes before you take actions. No, not at all. And as a diabetic patient, or as a high blood pressure patient, you should know that checking your BP checking your BP is something you have to do every single day of your life, every single day. And then you take your medication when you ought to prevent this thing. And when stroke comes in, stroke is not a death sentence. Also, as I said earlier, we have two types of stroke. The hemorrhagic stroke, those are the ones maybe through accident, when you hit your head on something, and then probably there's an outburst from your vein, the vein in the head, it got burst, and that one is one of the stroke. Those ones is actually 50-50, even though it can be done through surgery, but it's 50-50. I can't guarantee that. But the ischemic stroke is as a result of high blood pressure and high blood sugar. Those ones can be easily attended to, can be easily treated, but it depends on your doctor. It depends on your doctor and yourself. So, but you don't need to fear. Whenever you're having any issue like that, you should be able to quickly. When you're being admitted, what you do first is, after the whole thing has been stabilized, the sugar level has been stabilized, or the high blood pressure has been stabilized, you have to be discharged, and then you go for your physiotherapy. This physiotherapy will know what to do with you immediately, and it shouldn't take. I'm sure that when you take proper precautions about stroke, you live longer. Do this, that your days may be long.